push these days to lose weight and get in shape, still a lot of concern on the part of the American public on where to go, what to do, who to turn to. A lot of confusion out there, a lot of contradiction. But when you talk about Living Well Dallas, you get to really understand where they're coming from. They don't deal with individual symptoms. They look at the person as a whole.
Statistically, if you look at it, the baby boomer population, over 70% of baby boomers have tried something that was considered alternative a few years ago. So to me, what we really are is integrative medicine. We're the bridge to the gap between what would be conventional care and what maybe several years ago was something somebody tried, you know, when they met their end. They had tried everything else. And so we're now able to put them all together. And really what we do at Living Well is provide that bridge so conventional medicine can work along what people are already trying. If you look at all of the common diseases Americans die from, diabetes, cancer, and heart disease, 75 to 95% of all of the symptoms that lead to that are diet and lifestyle related, and of which our conventional medicine has very poor ability to address. And so we're able to really do that here, and instead of it being alternative, it really is enmeshed with it. And what we originally put together was obviously a physician, because medicine really starts with the physician. And then we brought in the nutrition piece, the counseling, the massage, the life coaching, and organizing. And then over the years, we've brought in additional services like chiropractic and acupuncture as we had the ability to integrate them into that system.
I am here because I've been seeing Betty for several years now, and she's helped me transform my way of eating and my body and my health. And it doesn't matter how many medications you're on or how much you exercise. There's this balance. And everybody, I think, has something specific that they have to do to have optimum wellness. And I feel like Betty and her group here, I think they can help you tweak that and help you in areas where maybe you don't know everything. They can help you be healthier, and that's the key to a long life. We're seeing that in all the clinical studies, and watch television and read books and look at what diets are around, and it's all about, you know, taking care of your body.
What makes us great, I think, is that we really want to focus on what you need when you walk in the door. We take the time to ask a lot of open-ended questions to figure out maybe what is the core problem of what's going on, because a lot of people say, gosh, I want to lose weight. But we spend most of our sessions talking about the job that they hate, or the relationship that's not working, or their kids are driving them crazy. Sometimes what they think they want or what they think they need is not really what's happening there. So we have to ask a lot of questions, and nobody's on sort of a standard program. We have to work with that person's lifestyle, their budget, their support systems, knowing what's going on in their body or their minds, and try to address what they're most ready for first.
The trust factor here at Living Well Health and Wellness is something that's it's a very safe environment. They've always been open to the individual needs that I've had and help to provide and fulfill that, and they would be the first to refer you to someone else if the need arises. But there are just a lot of synergies, and I think what they're doing is top-notch in how they're helping their clients in all the different modalities of work-life balance and nutrition, and I don't know of another place that provides all of the breadth and width of what Living Well Dallas does to help you in pretty much any area of your life that you may be struggling or just want to improve on.
There's two aspects to functioning like a team. One is that nobody knows everything, and if you are surrounded by other people of like mind, then they can help you problem solve, brainstorm, come up with sort of a multi-dimensional plan to help someone with their health. Also, no one person has every skill that's needed to help somebody on the whatever road they need to be on to get healthy. Having a collection of people that all do sort of complementary things is the best way to come up with some sort of a comprehensive plan that's going to help someone get completely well.
In traditional medicine, I was not only not believed, but just pills were just given to me. And I did struggle with depression, and I'm so thankful that I have been able to really work on the emotional aspects of my neurocognitive function through natural means and through actually improving my whole body and how it works. That has resulted in my brain being able to function, and that I don't struggle with depression at all. In fact, I don't even take any supplements anymore that relate directly to my neurocognitive function. So I would say one of the beautiful things is that I have not had lots of medicines. So I've been really pleased with that.
I think there's a tendency in traditional medicine to just focus on cancer screening and cholesterol levels and things like that. And so you're going to survive, you're going to do well. What we're looking at is thriving. We're looking at how do we take that wellness and bring it to that next level. You know, how do we get you balanced emotionally, mentally, physically, spiritually? I started doing acupuncture because I had a treatment myself. And I said, wow, this really helps me relax, number one, and it helped me with a frozen shoulder. And then also functional medicine, which is a way of looking at the body's ability to come into balance. And even looking, you know, how are we different individually? So understanding somebody's genetic predisposition, maybe they need a higher vitamin D level because they don't store it, for instance. Or maybe they need to be off estrogen because they don't metabolize it well. So those are the kinds of things, kind of looking at genetic uniquenesses. I'm really proud of kind of offering that to people so they can say, I'm going to treat you the way you ought to be treated individually compared to a whole group of people.
I think the biggest results of working with Living Well Dallas have been just a new sense of calm and peace in our family. It doesn't feel as chaotic. Our house is more organized, our life is more organized, we have a lot more fun. One of the fun things we did with them was to create a family mission statement and to come up with a list of core values for our family. And doing that really helped us refocus on what we want, why we fell in love with each other 15 years ago. And so I really think that Living Well Dallas has been a just opportunity to really look at things from a fresh perspective and remind us of what's really important in our relationship.
What we do is really change people's lives. It's not simply giving them a prescription, take the blue pill, take the pink pill. We make definite differences in your life. Wherever you are in your health, it can be markedly improved. Ideally, people say, what age should a man come and see a physician like you? Ideally, 30. I do have some very young patients in that age group, but most of them are going to come in their 40s, 50s, 60s when they realize they're slowing down, they're putting on that weight around the waist, they just don't feel as good as they used to, the libido's down, their sexual performance is down. It's not all testosterone. You've got to put the whole package together and take a 360-degree look at their health. That's the difference I do than conventional medicine, which each specialist looks at you through their own little microscope. I take a total look at your health system, what's going good for you, what's going bad, and let's repair it. Bring you up to an optimal health and then maintain that.
I was doing a lot of things that were associated with my family and my kids, but not really taking care of myself mentally and physically. Things like sitting on the meditation cushion, playing my music, exercising, doing the things that I need to do for me first, to remember that those are the things that keep me healthy so I can be the best dad and the best husband that I need to be for my family. And so Living Well kind of returned my focus to those things.
There are a lot of people that are not ready to quit a certain behavior, but maybe they have somebody else in their life that's going, gosh, I wish they would change their diet, or gosh, I wish they would quit smoking, or gosh, I wish they would exercise more. And then they end up, you know, maybe by persuasion or whatnot, coming through the doors. But that's really not what they're looking for. So we have to ask those open-ended questions to nail the root of the issue and then help them work on a plan for this 3 months. You know, what are your goals for this 3 months? And to me, that's part of what client-centered care is. It starts with listening.
I think as a woman, it's kind of comforting because you come in and there's a group of women, so you do have that common bond in a way. It's almost like a starter because you come in, you get adjusted, you have a massage, and it makes you feel good. So from that, it's like, okay, what else do I need to do to my body to feel good? You know, then it comes into the nutrition. You know, do I need to eat right? Do I need to practice yoga or have acupuncture? Just that whole feel good and know that you're living well.
When we first started looking at what modalities go together, I mean, obviously medical facility services, primary care, family care, nutrition makes perfect sense, and counseling, we knew that made perfect sense, and massage, because that's a part of it. Chiropractic care, what's interesting is a lot of times when people first step out of the conventional model, it's because of pain. And chiropractic is an early adoption product. And so chiropractic made sense. Well, then you look at acupuncture. It also is very, very good with pain and hormone management and all these other modalities. So we bring in acupuncture, and then we brought in energy medicine and other pieces. I'm always on the lookout for what modalities make sense, what fits into this model, and then what also has scientific research basis to show efficacy, and then whether it really can integrate into this model and work well.
Living Well is all about preventive care, health care, and self-care, giving you the opportunity and the tools with which to go out in the world and learn how to take care of yourself and live well. They've done extremely well here in the city of Dallas, and they hope to do so in other communities and other cities around the country. But they'll only do so if we, as a public, understand that it's not just about individual symptoms. It's about the total package and making certain that you are given the opportunity to enjoy your life and live well.